Welcome to You and Your Pets. I am Jim Horton, and we're here with our resident expert, Dr. Ernest Rogers of Maplewood Animal Hospital. And we have a special guest with us tonight as well. This is a program, of course, in which we discuss a wide variety of topics about pets, and tonight we have a particularly interesting one. Dr. Rogers, would you introduce our guest, please?
Thank you very much, Mr. Horton. I'm really pleased to introduce Dr. Tom Scavelli. He's an excellent golfer as well as a board-certified surgeon. Dr. Scavelli and I have known each other for about 10 years, and I've managed to be able to refer many of my cases, surgical cases that we couldn't handle in our house, to Dr. Scavelli, and he's a wonderful person and a great surgeon. So I've had the pleasure to work with him from Garden State, veterinary specialist down in Tinton Falls.
Very good. I'd like to start off very broadly, if we might. What kind of surgeries do you do, Dr. Rogers, and what kind of surgeries do you do? I mean, where's the dividing line? Where do you refer and where do you pick up?
I think, at least for me, when I feel that my skill set is limited for a certain surgery, I do a lot of soft tissue surgery. I don't do any orthopedic surgery. There are many other surgeries, neurosurgeries, that I would prefer not to do. Some other joint surgeries, such as stifle surgeries with an ACL, as we often see. I'll refer anything that I think is beyond my skill set to Dr. Scavelli, because Dr. Scavelli and his team at Garden State do these things 50 times in a year, where I might do one or see one or two in a year. So the skill set and the experience rests with Dr. Scavelli. So for each veterinarian it's different, but for me it's anything that's beyond my skill set.
I think there are probably three different scenarios. One is, like Ernie said, is just your comfort level and training with certain procedures. And a lot of it is equipment. Most of what I do is orthopedics, which takes very special equipment, which the general practitioner, if they're seeing one or two cases a year, they can't have that equipment, nor can they have the expertise to use that equipment, while we may use it 20 times a week, in all honesty. So part of it is things like neurologic surgery, chest surgery. We need certain anesthetic instrumentation that the general practitioner would not normally have. Spinal surgery often takes certain diagnostic things like an MRI or a CAT scan, which most general practitioners can't have in their practice. The other group there is just the ability to monitor patients 24 hours a day. A lot of our patients, some of the abdominal surgery we do, the general practitioners like Dr. Rogers would normally do. However, the surgery care of that patient doesn't end when that dog or cat gets off the table. They need nurses 24 hours a day for pain management. They need nurses to monitor vital signs at 2 in the morning, at 3 in the morning. And so the general practitioner realizes they don't have that staff there to take care of that patient. So that's another group of patients that we would see. And then the third is just from the anesthetic standpoint. There are some patients that are really small, or some patients that are really large, that are high-risk anesthetic patients that the general practitioner doesn't want to, he doesn't believe that their staff may be comfortable with some of these, for example, 2-pound Yorkshire Terrier. So we see those patients just from an anesthetic standpoint. I get referrals for a 2-pound Yorkie to spay them sometimes because the veterinarian doesn't feel comfortable doing the anesthesia and then getting them through the spay, when they can obviously are very competent to do the spay. So it really is a team approach. I mean, my clients really are the veterinarian. I work with the veterinarian. They'll discuss things with me on the phone, and things that they are comfortable or not comfortable with, and if they want us to do it, then we're happy to do it. So I think it's equipment, training, and then nursing, 24-hour care.
So it would be fair to say that you get referrals from all over northern New Jersey, Staten Island?
Absolutely. Yeah, I mean, we have about 500 veterinarians that refer to us.
Oh my.
500 veterinarians, 250 practices throughout New Jersey, Staten Island actually quite a bit, some parts of Pennsylvania. So yeah, no, and then there are some cases we saw a dog this week from Virginia, so we see them from all over, but mainly New Jersey and New York.
Now, you mentioned very small, and you mentioned a Yorkie, and you also mentioned very large. Now, I understand you've done some fairly large patients in the past.
Yeah, I mean, besides seeing very large canines, I mean, we do see some mastiffs, for example, that are 200 pounds or 240 pounds. They get a lot of orthopedic issues, so we see those dogs relatively routinely. But we've also seen exotic patients. We have a CAT scan and an MRI in our building, and occasionally there are some of these exotic patients from the zoos that need diagnostic imaging, and so we've had a tiger that was about 300 pounds for a CAT scan. And then we get some wildlife like deer, goats occasionally come on emergency. They're rare, but we do see some of them as well.
Take us through the procedure, if you would, of how you actually handle. I mean, first of all, the animal obviously has no concept of what's happening to it. How do you begin with let's just take a dog that might be on the order of 20, 25 pounds. How do you prepare that animal for surgery?
Well, a couple of things. Remember, most of these patients, I've had a relationship with them in the exam room with the family. So I usually see them on a consult first, where I meet the people, they talk about what's gone on, and I examine the pet with them there. And so there's that half-hour consult time that I get to make a relationship with a dog or a cat as well as with the family. Then when we admit them for surgery, obviously just like when you and I are in the hospital, there's some anxiety that goes with that. For them, maybe a little bit greater because they can't understand it. So many of them are, they're pre-medicated. We don't just take this animal that has a lot of apprehension straight into the prep area where they're going to be anesthetized. Many of them are sedated first. They have IV catheters put in first. So by the time they get to the area where they're going to be induced with anesthetics, they often are quiet, relaxed.
Mellow.
Yeah, that'd be a good word for it.
Now, you mentioned several kinds of surgery. I'd like to go into some of that, if you would, please. First of all, what do you mean by neurological surgery? What exactly are you doing in that area?
Really two main things. Probably the most common is spinal surgery. Dogs, especially cats to a small degree, but dogs, it is a relatively common scenario in small breed dogs, especially certain breeds. The dachshund being the most notorious for people to relate to, have a syndrome where they will slip a disc in their back and it will compress their spine and they will become acutely paralyzed. I mean, they're normal 1 minute and paralyzed 2 minutes later or an hour later, gradually over an hour.
So just to explain, the disc is a pillow between the two bones, the two vertebrae, that when it bursts or slips, the two bones come together, crushing the nerves or affecting the nerves. So I just wanted to put that as a point of reference for the people.
Yeah, so the center part of the disc has two parts to it. There's an outer doughy part and a more center gelatinous part. And in this syndrome, the center gelatinous part herniates through the fibrous part and literally jams into the spinal cord and then pushes the spinal cord against the bones that Dr. Rogers is talking about. In you and I, when you herniate a disc, very often our spines end in the middle of our back. So when you herniate a disc, we get sciatica, we get tingling in a leg, we get back pain. The dog's spinal cord, especially this poor little dachshund, ends very close to his tail. So when he herniates a disc, it really goes into his spinal cord itself, not just nerves. And so they're often paralyzed. So they need emergency surgery to take the disc off the cord, to take the pressure off the spinal cord so the cord can start to regenerate. That's by far the most common neurologic surgery we do. Our neurologist, honestly, yesterday did 5 dogs with just that condition, just yesterday.
Oh, my.
And then brain tumors are another. Dogs and cats get brain tumors. We see elderly dogs that come in for seizuring or for abnormal behavior, and we have an MRI in the hospital, and they get brain scans, and some are treated with surgery. We also have a radiation unit. Those that are inoperable can be treated with radiation therapy, just like in people. So there are some other conditions too, trauma to the spine. Dogs get hit by a car, God forbid, they can break their back. We have to operate those patients. Some certain birth defects, there are certain breeds the Doberman and the Great Dane, most notably, that are born with certain congenital conditions in their neck that pinch the spinal cord, and around the year of age start to walk kind of like a drunken, unsteady gait. Those dogs have, some of them have need for spinal surgery as well.
Okay.
Pelvises, when a pelvis is injured and the nerves become entrapped, that's another situation. So a lot of these are trauma or congenital.
Correct.
How about heart surgery?
Nowadays, a lot of the heart surgery, just like in people, is interventional by the cardiologist. And when I was trained in the early 1980s, a lot of the surgery was opening up the chest, going between ribs and working in the chest. Nowadays, just like in human cardiology, a lot of it is through catheters that are put in major veins and arteries and done under a movie camera X-ray called a fluoroscope, where they look at the heart and they relieve obstructions, or they close down veins that are abnormal at birth with putting coils in them, like they do with people with atherosclerosis. So nowadays, most heart surgery, pacemakers, a lot of that is done with interventional. We don't do as much open heart surgery as we used to, because the interventionalists and the cardiologists do a lot of that.
And I'll just refer some of our listeners to a program that we did previously with a colleague of Dr. Scavelli's, Dr. Goodwin, who was the cardiologist from Garden State Veterinary Specialist and came here and spent the time with us.
That's exactly right. I remembered. I was surprised that you were putting in pacemakers, and he looked at me like, "Where have you been?" You know, and I just was not aware that animals had pacemakers at that time.
Yeah.
Are there any other major categories of surgery we haven't covered at this point that you?
I mean, abdominal surgery, I mean, there are a lot of, we see a lot of patients with intestinal obstructions, for example. Dogs and cats swallow a lot of things.
Yeah.
And they get obstructed, and they come in vomiting, and they can't eat, and that's a really common procedure. And then abdominal cancer, I mean, as pets age, we see a fair amount of cancer of organs like the spleen and the liver and the kidney that eventually either cause organ dysfunction, or they rupture and bleed into the abdomen acutely that need pretty rapid surgery. So that's also a very common area for a specialist in surgery, because a lot of that, we have a very busy, at Garden State, a very busy emergency trauma portion of our hospital. So a lot of these patients are coming in being referred because, again, it may be 4 in the afternoon when this poor dog ruptures his spleen. Mm-hmm. The general practitioner knows not only does that dog need emergency surgery, but then he may need blood transfusions through the night. He clearly needs careful monitoring, pain medication through the night. That's really a lot of what our expertise is and what a lot of the use of our type of hospital is. Okay, we have to take a break. We'll be right back, and we'll talk some more about surgery of pets. This is You and Your Pets at Jim Horton.
Television is a powerful and influential medium that allows different groups the opportunity to produce programming that directly affects their own communities. Public, educational, and government access channels ensure that all people, regardless of race, age, gender, disability, religion, or economic status, have access to local government information and the use of a public communication forum. Make sure everyone has a voice. Support your local PEG channels.
We're back with You and Your Pets. I'm Jim Horton, and we're here with Dr. Rogers and Dr. Scavelli. And Dr. Rogers, I'd like you to take over this part of the interview and to go into some of the orthopedic, right? Some of the orthopedic areas that Dr. Scavelli does.
Well, I think we're lucky enough to know that Dr. Scavelli works on many different animals, and we have a little bit here about a surgery that he did on a red fox. But before that, I'd just like to ask Dr. Scavelli to go over some of the anesthetic procedures that he might use, because we really want to be aware that our animals feel pain. It is part of what we do as veterinarians to relieve pain and relieve suffering. And so if you could just briefly outline what an owner should expect when they come in, and maybe what kind of things we might do to relieve pain, some of the injections we do, the pre-op and the post-op.
Sure. Most commonly, we are pre-medicating these patients before You know, in the old days, it was thought you would do a procedure and then give a medication to modify pain after you took them through this painful procedure known as surgery. Now we know that they have much better pain control if we have these pain medications available and on board in their body before they experience the painful experience. So we actually pre-medicate them, as I mentioned before, with drugs that, narcotics, very often that will help modify their pain once they recover, and then they get more of these narcotics after surgery. So very often they're treated with, they're all obviously fasted, they're given narcotics as a pre-med, and then they're in, IV catheters are put in. They are then induced with a short-acting injectable drug. Most of the times nowadays we use a drug called propofol that a lot of people are familiar with. A lot of people get it for short outpatient procedures in the hospital. Then we pass a tube where we deliver gas. Typically in our hospital it's isoflurane and oxygen. They're then placed on monitors where we monitor obviously their heart rate, their pulse ox, the amount of oxygen within their blood system, their CO2 that's being blown off and in their venous system.
And we should just mention that the CO2 is what stimulates breathing. So monitoring the CO2 is important, as well as the oxygen, the blood pressure,
Exactly.
the EKG or the heart monitor.
Body temperature as well. And we have a trained nurse anesthetist, a licensed veterinary technician who all their job is to sit and monitor all the vital sign parameters during the procedure, things like heart rate and blood pressure, ventilation. We have ventilators on every anesthetic machine. So if for some reason this dog or cat is not breathing well on their own, we have machines that can breathe for them so they can breathe more evenly and more controlled. Then they're maintained on these anesthetics while they're being monitored through the procedure. They recover. Again, they're given more narcotics. For some procedures, we do things more potent than just giving injectable narcotics. There are some patients that we start on narcotic patches 12, 24 hours before surgery. Some of our orthopedic conditions, we use patches of fentanyl and our pretty potent narcotic that we'll put on so they have really good blood levels at the time they go to surgery. Some of our orthopedic conditions, we actually do spinal blocks on. When we put them under anesthesia, we do something called an epidural block to block the nerves going to the area that we're operating on, which will then have a prolonged period of pain relief after surgery. Sometimes we block a joint or block the chest. We put local injectables in to kill pain on the area that we just went through a procedure.
I know we need to move on to the fox, but just one very quick question. Do animals have the same kind of withdrawal symptoms that humans do for some of this?
You know, they're not on it for long periods of time. They're in the hospital for, say, 24 to 72 hours when they're on narcotics. They then go home on oral synthetic narcotics. So, no, I don't think, we don't often have them on these drugs for weeks on end.
Okay.
So I don't think that's an issue for our patients.
And they really don't ask for it after they've left the hospital. So I think we can be relatively assured that they might not even have a sense of what's happening to them. And I don't know if they have the same pleasure that a human relates. It's a learned experience for a human, so I wouldn't think that.
They're probably typically on it for 3 days, and then they're on this synthetic narcotic for 5 to 7 days, but that drug is not addicting.
Okay.
Well,
So let's move on to the fox.
well, I think before we do the fox,
Okay.
we talked about pain management and how pain management is important, and I think one of the things that you do in your hospital that we also do in human surgery, or is also being done in human surgery, is hip replacement. And I think you also have a stem cell program for knees and hips. And just really briefly, if you could just, your hip replacement, your knee replacement, you get the prosthetics from a company, and
The hip replacements is by far the most common in veterinary orthopedics. It's been done for probably 25, 30 years now for dogs with end-stage hip arthritis, mainly hip dysplasia, which people are familiar with, occasionally for trauma to the hip. But we put in a synthetic ball and then a synthetic or vinyl cup. And it can be done on all size patients. It tends to be more commonly on larger patients, but we do in our practice probably 70 to 80 patients a year of total hip replacement. Total knees are becoming more commercially available in veterinary surgery. Still not that common yet. It's still in its infancy. We do a lot of knee reconstruction for ACL tear. That's clearly the most common thing that I see in the exam room every day. But yeah, we really are taking a lot of the human technology and bringing it to the veterinary arena.
And
Okay.
from the time I was in research, it seems like we're actually modifying, or we are developing the human technology that comes back for us to use. At least from my time in research, a lot of things are done in animals before they're administered to people. So,
Okay.
and then the stem cell.
Stem cell, we had hoped that stem cell therapy might help, in the case of orthopedics, help grow new cartilage cells. It seems like its main benefit is with a pretty potent anti-inflammatory effect. It does seem clinically to work pretty well in the hip, for example. Not dogs with severe lamenesses that are not using their legs, but dogs with more moderate lamenesses. Many of them can get 6 to 18 months of good clinical relief of pain with stem cell injections. We harvest their own fat cells and then send it to a lab that spins it down, and procures their own regenerative stem cells, and then we inject it both intravenously and into the joint. And yes, we have had very good promising results with that.
And having said that, I think Mr. Horton would like to move on to the case that you brought today
Sure,
to show
absolutely.
us. That's a red fox that has come to your clinic for a knee problem, and this is the veterinarian who brought it, and it's from the...
This is Dr. Puglisi. She was the veterinarian for the Staten Island Zoo. This is a red fox named Lady who had been lame on the rear leg for several months. Obviously in the zoo couldn't get much orthopedic care, so she called me up and said, can I bring her to your clinic? She was really a really sweet animal.
As you can tell, because most times when we deal with animals of zoo nature, we muzzle them and knock them out completely. And so this
fox
amazing
was really
picture.
good and very easy to handle. And Dr. Puglisi was really good with her. So we start here where our surgery technician is going to induce anesthesia. He's putting a catheter in the cephalic vein in the arm, and that's the vein that we're going to administer the anesthetics, the injectables I talked about earlier. Here now she's anesthetized, and I'm just showing where we're feeling her knee and confirming that her knee is lax due to a tear of the anterior cruciate ligament. People know of it as the ACL, and that's what she had, an ACL tear, and so we confirm it on palpation.
Very common football injury. We hear a lot about it in football and basketball. And so what you're doing there actually is looking for a drawer response or a slippage of the bottom part of the knee on the top part of the
Yep,
knee.
exactly
And that's
right.
something that I do in my clinic, and I then refer them to you to do the surgery. So that's where the line comes.
So here we're just taking her through different ranges of motion before we're going to start to prep her for surgery. So this is just the OR, just to give your audience an idea that, we do things under sterile conditions. We wear caps and masks and sterile gowns, and you can see the anesthesia machine in the background. These are human machines that we purchase from human hospitals when we set up the practice with all the monitoring equipment. They're draped in, sterilely draped in, and it's all done under extreme aseptic conditions.
The surgical site is scrubbed with a antiseptic solution. This is after an anesthesia, and then Dr. Scavelli will come in, and you'll have technicians and other surgeons, other veterinarians, help them and drape them in and make a cut and go in. But
Typically, how many people are on a team?
Well, typically there's 2 people at the surgery table, the main surgeon and then an assistant surgeon. That would be the norm on most cases.
And the anesthesiologist?
And plus the anesthetist. Now, we brought up total hip before. Total hip's the one exception. Hip replacements, in our hospital, we have a team of 4 people because there's so much maneuvering of the hip, and then it's much easier to have 3 other pairs of hands besides the head surgeon. So often there's 4 people at the operating table in hip replacements.
Okay.
so now this is the machine that we use to monitor the animal during anesthesia. And
And you can see it has all the parameters on there, things we talked about before, the EKG, heart rate, blood pressure. You can see this, at this point, the Fox's blood pressure was 151/95, and it's being monitored every few minutes. The end-tidal CO2 that we mentioned before, the carbon dioxide, respiratory rate, body temperature. So these are being evaluated constantly in real time. And if there's any changes, then we have, in our practice, we have 2 board-certified criticalists, doctors who specialize in emergency critical care. If there was a problem, and our cardiologists, they would be called in to help deal with any of these aberrations that are occurring during anesthesia.
Okay, well, we're running short on time,
okay,
so let's
well,
look at the others
we'll
here.
just go through this, and this
as
is
fast as
the
we can.
nurse
Our nurse
anesthetist who monitors the anesthesia. This is actually the open joint that was being
This is just bringing
corrected.
the fascia back to get into the joint. Here we are inside the joint. We're looking at the anterior cruciate ligament. We're removing the remnant of it.
And why don't we just hold right there, because that shows the entire leg.
Post-surgically.
Yes.
Post-surgically, and you can see the incision made, and the animal wakes up and goes on to lead a nice, normal, healthy
No,
life.
she did great. She's running around Staten Island Zoo as we speak.
Okay, I want to thank you very, very much for
Thank
taking
you,
the
I
time
appreciate
to
it.
come and visit with us. This has been most instructive. And once again, where is the hospital located, once again?
The main hospital is Garden State Veterinary Specialist in Tinton Falls, New Jersey. We also have a satellite emergency practice in Island, New Jersey. That's Garden State Veterinary Services, which is open evenings and weekends, and probably within a few months will be open 24/7 as well.
And I refer to both of them.
Okay,
So-
but someone doesn't just come into you. They're almost all referrals in this
Yes.
case, to make very clear to our
They're referrals from other
viewers.
veterinarians or emergency cases that come,
Right.
on an emergency basis. Absolutely.
Referred again from me or one of the other local
From their primary
practitioners.
veterinarian.
Okay. Well, once again, thank you very much. This has been You and Your Pets. I'm Jim Horton, and we've been here with Dr. Ernest Rogers and Dr. Scavelli. And thank you very much for watching.